The leading causes of death for males are heart disease, cancer, and stroke. These conditions can be attributed to modifiable health risks, including high stress, tobacco use, body weight, physical activity levels, and nutritional habits. Cardiovascular disease, or CVD, is one of Australia's largest health problems and is the disease of heart, stroke, and blood vessels. CVD is responsible for 1 in every 4 male deaths and is the leading cause of death. CVD is largely preventable, and half of the men who die suddenly of heart disease had no previous symptoms. The risk factors of cardiovascular disease are high blood pressure, high blood cholesterol, excessive alcohol, diabetes, overweight or obesity, physical inactivity, and poor diet. Skin cancer occurs when skin cells are damaged by overexposure to UV radiation from the sun. Sunburn causes 95% of melanomas, and men have almost double the incidence of skin cancer compared to women. The symptoms of skin cancer are any crusting, non-healing sores, small lumps that are red, pale, or pearly in color, new spots, freckles, or any moles changing in color, thickness, or shape over a period of weeks to months. If you experience any of these symptoms, see your local GP or skin cancer clinic. Type 2 diabetes is diagnosed when the pancreas does not produce enough insulin or the cells of the body do not respond to insulin effectively. Type 2 diabetes results in high blood glucose levels. It usually develops in adults over the age of 45 years, but is increasingly occurring in younger age groups. There is no cure, but it can be managed through lifestyle modifications and medication. A low-sugar diet and regular physical activity will reduce your risk. Diabetes can be prevented. It is important to screen for your risk of diabetes before it occurs. Overall, men have higher rates of overweight and obesity than women. Abdominal obesity is associated with high rates of cardiovascular disease. But there is a simple solution. Consume less energy than you burn through physical activity and metabolism. Consume food and drink lower in energy, such as vegetables, grains, lean meats, nuts, seeds, and fruit. Increase physical activity and drink plenty of water. When you're feeling down, taking action to call in extra support is the responsible thing to do. If you're feeling down and not sure why, the best way to manage it is to talk to someone. On average, 1 in 8 men will experience depression at some stage of their lives, with blokes making up an average of 6 out of every 8 suicides every single day in Australia. Distinguished by prolonged feelings of sadness and lack of interest or pleasure in usual activities, lack of energy and concentration, sleep problems, loss of appetite or weight gain, and feeling guilty. So whether it's your physical or mental health, remember, don't bottle it up. Talk to somebody. For more information, talk to your GP.